You are here today for the FEDVIP and Benefits Review. I am Connie Delormier. I work with the program office, and you may have seen my name around. With me today are Beth O'Brien, who is from FedPoint. FedPoint is formerly known as Long-Term Care Partners, and as you probably know, they are the contractor for benefits. Also joining us from FedPoint is Vicki Silvernagel, and we'll hopefully be answering any questions you may have. So actually, we've got about 1 minute, and then I think we will be on our way.
Yeah, and actually we pushed out to the audience, if anyone's having any technical difficulties, any audio, what have you, there's benefits@opm.gov. You can email them, and they're running troubleshooting if you're having any problems for today's presentation.
And that is benefits.
Correct. Yep.
Just to be clear.
Not benefits, right.
Okay. Well, I think we can go ahead and get started. You all are familiar with FEDVIP in a way, as the audience here today is agency benefits officers. So today we will be working on or reviewing FEDVIP Basics and Eligibility, just basically how FEDVIP and benefits work together, the specific functions of each, and we'll review enrollment and premium details, as well as reviewing the benefits website and the comparison tool. We're going to highlight benefits' many self-service functions and demonstrate the many actions that employees can take for online themselves during open season and outside of open season. We'll provide details on QLEs, and we're going to cover Incapable of self-support. That's always one that has a lot of questions, as well as some other resources and things for employees and benefits officers. You can type questions in this chat at any time, but as far as the Incapable of self-support goes, if you can wait until we reach that part of the presentation, that would be great, because there's usually a lot of questions about that. So we will get them. We'd like to kind of go over questions as we receive them. So hopefully that will work out for you. So what's the difference? FEDVIP and benefits, both of these terms are related to dental and vision, but there is a difference. What do both of these terms represent? And Beth's going to start with that.
Yep. So they're related, but they are different, and sometimes employees get confused as to who does what. So FEDVIP is the Federal Employees Dental and Vision Program, which was enacted back in 2004. It's a voluntary enrollee payout program sponsored by OPM. It's also separate from the FEHB program. Now, some FEHB plans may provide some basic coverage, for example, discounts or services like a routine eye exam. So FEDVIP is for when you and your family want more comprehensive coverage, including vision correction, if we're talking about vision there. And of note, unlike the FEHB program, there's no 5-year rule to carry FEDVIP into retirement. So no 5-year rule for FEDVIP. Now, civilian and U.S. Postal Service employees and annuitants can enroll in dental, vision, or both. And many plans have both standard and high options to fit your family's needs. And for those of you who are joining us who might work with military families, for example, you might be working on a base today, FEDVIP replaced the former TRICARE retiree dental program back in 2019. And Connie, before I get into the eligibility groups, I just want to touch briefly on what benefits is. Just briefly.
Okay, I'm sorry.
It's okay, but while FEDVIP is a program, benefits is a portal or a platform. So it's the enrollment and premium processing system employees must use to obtain FEDVIP coverage. Your employees can shop, compare, enroll in a FEDVIP plan during open season, or if they're newly eligible, and they can manage their coverage online outside of open season on the benefits.com website. Benefits also has a call center, which we staff up for during open season, but there's so many self-service functions that people can perform right on the benefits website, and we're going to highlight those throughout today's presentation. Lastly, premium allotment for the FSA Feds and the long-term care program are under BeneFeds as of a couple of years ago. So it could be that you have employees interacting with BeneFeds even if they're not enrolled in the FEDVIP program. So Connie, if you want to go on to the eligibility group, I'll touch on who is eligible. So obviously active and retired federal employees and their family, active and retired U.S. Postal Service employees and their families. In addition, certain uniformed service members and their families are also eligible, and we'll review this group a little bit more in a moment. In general, though, FEDVIP eligibility is determined by laws and regulations. OPM, the FEDVIP carriers, or BeneFeds, none of us actually make any determinations on program eligibility. Now, you can only enroll as part of one eligibility group, so either under the federal civilian status or the uniformed service status. And some of your employees may be duly eligible for FEDVIP. For example, there's a retired service member now working at your agency as an active federal employee. So they have a choice on how they want to enroll in FEDVIP. Remember, they can only enroll as part of one eligibility group, so they can't have two FEDVIP plans. Now, there is no difference in plans or premiums. FEDVIP plans and premiums are the same for all eligibility groups. They only vary based on the region where they live for FEDVIP dental and the sort of plan they select. So if you want to move on to the key differences, thanks, Connie. So say someone is duly eligible, how do they decide how to enroll in a FEDVIP plan? So we'll look at a couple factors that may help them with the decision. So for federal civilian employees, premiums are pre-tax and unmarried children are covered up to the age of 22, not 26, age 22 for FEDVIP. And then for uniformed services, FEDVIP premiums are post-tax always, and unmarried children are covered up to the age of 21 for non-students and age 23 for full-time students. And this full-time student status must first be registered in DEERS, which is the Defense Enrollment Eligibility Reporting System that military families are very, very familiar with. Now, typically we find that parents want to keep their kids on their plans as long as possible. So it could be that a duly eligible individual decides to enroll in the FEDVIP as uniformed services because they know they can keep their kid who's in college on their plan until age 23. The last consideration here is a very simple question is how do people want to pay their premium? So if there's an active federal employee who's also a military retiree, I run into a lot of them who say they really prefer to have their premiums come out of their biweekly pay because oftentimes it's going to be more money that's in their military retirement. And if you want to move on about health plans, the next slide, Connie, there is a consideration of how your health plan may affect your FEDVIP eligibility. So we'll take a quick look here. So for federal and U.S. Postal Service employees, they're eligible for FEDVIP if they're eligible for the FEHB program. Now, they don't have to be enrolled in the FEHB program, they just have to be eligible. Now, some of you may also service your agency's annuitants and retirees. So no, for those folks, they're just eligible for FEDVIP. They don't necessarily have to be eligible for the FEHB program. So it's a little bit different for civilian annuitants. For uniformed services, most retirees and their spouses, family, and survivors are eligible, for FEDVIP dental, period. They're just eligible. And most retirees, their spouses, family, and survivors, and active duty family are eligible for FEDVIP vision if enrolled in a TRICARE health plan. So there's a couple distinctions there. They're automatically eligible military for retirees for dental, have to be enrolled in a TRICARE health plan for vision. And here's a list right here of the TRICARE plans that would affect vision eligibility. So Connie, I'm going to pass it up to you to review FEDVIP dental plans a little bit more in detail.
Okay. Whoa, did I skip too much? Where was I here?
Keep going. Oh, keep. Okay.
There we go.
There you go.
Yeah, I got a slick mouse here. All right, so we have international or nationwide, which also covers international plans, and we have regional plans for dental. And employees have a lot of flexibility and choice because of this. So there's 7 nationwide plans and 5 regional plans. For the nationwide plans, which also, again, covers international, we've got Aetna, Blue Cross Blue Shield, FEP, Delta Dental, GEHA, MetLife, United Concordia, and United Healthcare Dental. Now, a lot of these names you've heard for many, many other things. Many organizations also have plans under them. So we always encourage employees to share the list of FEDVIP carriers with their preferred provider before they enroll to ensure that the dentist accepts their plan, the federal plan. Regional plans that are available are Dominion, which covers several of the Mid-Atlantic states, Emblem Health Dental, which is basically New York, but also has some of New Jersey and a couple of counties in Pennsylvania, Health Partners, which covers Minnesota, the Dakotas, a little bit of Iowa and Wisconsin, Humana Dental, which covers most of the southern United States, and then Triple S Salud, which is strictly in Puerto Rico. So nationwide versus regional, we try and have something for everyone here. So we've got nationwide, which will cover out of network and international coverage if you need it, if you go out of the country with your job or just for pleasure. You pretty much have coverage anywhere with nationwide. Now, if you don't feel like you go to the dentist a lot and you don't want to pay a lot of premiums, regionals are generally a little less expensive, but they only cover in-network coverage. So you have to make sure that your dentist, your provider, is part of their network. They will cover emergency coverage outside of the region. So regardless of whether your employees opt to enroll in a nationwide plan or a regional plan, it's still important to note that if their provider leaves the network, no matter what time of year, they can't change plans just because their provider leaves in order to follow the provider. That's not a QLE. The employee is going to have to wait until open season if this occurs. So what does FEDVIP cover? Okay. We have a list here of the things that every FEDVIP dental plan covers. Basically, in-network preventive services such as cleanings are covered 100%. For in-network, there's no deductible. And there's no waiting period for major dental services. I'm saying dental services, such as crowns, bridges, dentures, and implants. There is, however, on just a couple of the plans, we used to have it on all, but now there's only one or two of the plans that still have a 12-month waiting period for orthodontia. That means they must be enrolled in the plan for an entire 12-month period before the plan will pay for orthodontia. It's mostly just the standard options, but there are still a couple of plans that do that. But most also, there's not an age limit anymore on most plans. There's still a couple that only cover dependent children, but most no longer have the age limits. And you should also note that a lot of the FEHB plans do include some dental coverage. So enrollees should look at both the FEHB brochure and the FEDVIP brochure together, figure out what they need when they're selecting a plan, and also just to make sure they know exactly what they're covered by.
So I'm going to take it over from here for vision, but we did say we wanted to address some questions throughout. So someone actually typed in, I just want to clarify a little bit on eligibility. It's funny, Vicki, you and I were just talking about this the other week. They write, members of Congress are eligible for FEDVIP, even though they're not eligible for FEHB. And yes, I believe that's a true statement.
That is, yes,
Yes, so
it's a great statement.
Yes.
Yep, so thank you for the clarification. I'm not sure if we have any folks from those agencies on the line, but that actually is a true statement. So I am going to move on to FEDVIP Vision. Now there's 5 nationwide international vision plans available for the 2022 plan year. So no real changes from last year. And most of the carriers listed here also provide FEHB and or FEDVIP dental coverage. So the name should be pretty familiar to you. So there's Aetna Vision Preferred, Blue Cross Blue Shield FEP Vision, MetLife Federal Vision, United Healthcare Vision, and BSP Vision Care. And unlike dental, vision premiums are not determined by where you live. The FEDVIP vision plans each offer their own nationwide premiums. It's important to note, though, there's no linkage required, meaning you don't need to be enrolled in the same company across the board. So, for example, you can be enrolled in United Healthcare FEHB, Blue Cross Blue Shield FEP Dental, and Aetna Vision. And it all depends on what plans and premiums work best for your family. So moving on to what does FEDVIP Vision cover? So we said that most FEHB plans, even TRICARE, offers a basic vision benefit, such as a routine eye exam. And FEDVIP Vision is for when you and your family want more coverage. And this happened to me a lot. I used to cover a lot of health fairs back when they used to happen. And I meet people at the table at their agency health fair who wanted a new pair of frames every 1 or 2 years. And for them, it was just a style thing. Or they like having different lens options, such as progressive or transition lenses. And I often meet parents who have kids who are always breaking or misplacing their glasses. And these are the sorts of situations that would prompt someone to look at supplemental vision coverage. So FEDVIP Vision covers the types of care shown on the slide. So eye exams, vision correction without a referral, also eyeglasses, contacts, an array of lens options, and discounts for laser eye surgery. And before I move on, I just want to remind everyone that your FEHB plan is always going to cover medical care and treatment, like an injury or a condition like glaucoma, cataracts, dry eye, or pink eye. These are medical conditions. So I want to make the distinction between medical care and vision correction, because again, that's another anecdotal feedback I would run into at health fairs. I would direct folks to their carrier to answer their medical questions, basically. Now, there's 3 enrollment options with FEDVIP, self, self plus 1, and self and family. And these options can also be different than your FEHB plans. So it could be that you and your spouse have self plus 1 for the FEHB, but only you need FEDVIP Vision because only you wear glasses in the family. So you'd be self only for vision. Now, there's no such thing as dual enrollment with FEDVIP. So you can't have 2 FEDVIP plans. And if it's determined that you are covered under 1 or more dental or vision plans, one of those enrollments will be canceled. And this used to exist back before the TRICARE retiree dental program transitioned to FEDVIP. It could be that couples that were retired military and civilian could have 2 dental plans because they had 2 dental plans available. Now that the military retirees are under FEDVIP, they can only have 1 dental plan. Now, it's important to note, though, you can have FEDVIP coverage along with an outside or private sector plan. So it is possible to coordinate coverage with an outside non-government plan. And Vicki, I know you probably get these sorts of questions. How does that work? So if someone's enrolled in FEDVIP Dental, but they're also under their spouse's outside dental plan, is this common? Who pays first? How does that work when it comes to claims and coverage?
Yes, Beth, that is pretty common. And the easiest way to try to remember it, or I think the easiest way, is the primary on the account for FEDVIP. They would always go through their FEHB plan first, and then their claims would go through whatever carrier they're enrolled in. Now, the spouse on that plan, if they have their own insurance, my understanding is their insurance would bill out first, and then FEDVIP again would be the last payer.
Okay, thank you. Yeah, and I can imagine if people have costly dental services coming up, they might want to have 2 plans at any given time. Thank you. And then, of course, coverage automatically continues into the next plan year unless it's canceled or changed during open season. I want to thank you, Connie. And as you know, there's a special enrollment opportunity for new hires and newly eligible individuals. So all new hires and their spouses have 60 days from the date of hire to enroll in FEDVIP. And coverage is effective on the first day of the next pay period following enrollment. And once enrolled, the employee generally cannot cancel or change coverage until the next open season. Newly married spouses also have 60 days to enroll from the date of the event, and we're going to review qualifying life events a little bit more in detail a little bit later in today's presentation. Now, of note, newly eligible employees hired during open season can actually choose a new hire enrollment or an open season enrollment. So this is a consideration for those of you who are doing any new employee orientations. So this fall, for example, if someone's hired on November 22nd, they can enroll as a new hire and have coverage effective the first day of the next pay period. Or they can enroll as an open season enrollment, but caveat is the coverage is effective January 1st the following year. So it's probably in their best interest to enroll during open season if they're newly eligible as a newly eligible enrollment. Premium details, Connie. Thank you. Now, it is a voluntary benefit, FEDVIP is, which means there's no government contributions. It's an enrollee payout program. But OPM, the carriers work closely each year to determine the premium rates, and they're set at competitive group rates. Of course, the plan you choose will affect your premium, for example, a standard or high option, and where you live will affect or may affect your dental rates. And Connie, I know it's early in the season, it's only September 15th, but is there any news about FEDVIP premiums this year, or do you know when they'll be posted online?
Typically we try and release all of the new benefits and premium data sometime in the middle of October at the very latest. I would expect it sometime, in the first couple weeks of October. Not really sure. Haven't heard the exact date that all that's going to happen. Only thing I can tell you, which we didn't really note on these slides, is that our one plan that is an HMO, which is also a regional plan, is going to be an EPO this year. And that just means that your employees that are enrolled in that program just don't have to worry about making sure they have a primary dentist. They'll be able to see any in-network dentists now.
Okay, great, thank you. And of course, they'll be posted on the OPM site and also the benefits site too. So I know you have your own comparison tool online, which we'll review in a couple of minutes. So FEDVIP, as you know, is a payroll and annuity deduction program with premium allotments, obviously handled by benefits. And Vicki, these are the sorts of questions your area gets a lot, specifically during open season. Are there any premium details you want to add? Now, I know there's a handful of agencies that can't do payroll and annuity deductions. And I know sometimes there are instances where someone would not pay that way, but would pay through automatic bank withdrawal. So if you want to offer any commentary to that.
Absolutely. If the premiums are available through allotments or pay, if it's a civilian, we do go that route first. If for some reason the premiums aren't available, let's say an annuitant has insufficient funds and their annuity for us to collect premiums, then we will place them on direct bill. There are some situations like a survivor annuitant of a military individual, then that enrollment would be set up automatically in ABW, automatic bank withdrawal. And for some reason, if that wasn't available or the customer didn't want to provide their bank account, we can set them up as direct bill.
Great, thank you.
You're welcome.
Connie, if you want to advance to the next slide, I'm going to give a brief snapshot here of the benefits comparison tool. We're going to move on to choosing a plan. And obviously, I think this tool is very familiar to the folks in today's presentation. So the benefits plan comparison tool helps employees make their plan selection. It allows side-by-side comparisons of up to 3 plans, and showing the premium, which is important, but also showing cost-sharing responsibilities. I know these tools enhanced over the last number of years to really show exactly what the enrollee could be paying for. So it allows an employee to understand the potential impact of seeing, for example, an out-of-network dentist provider versus an in-dentist network provider. And as shown on the slide here, for out-of-network charges, the enrollee often pays co-insurance plus any amount that is greater than the plan allowance. So, Connie, I know that you can move on to the OPM comparison tool, but I know we want to be upfront with folks to let them know really upfront what their cost sharing could be, which is fair.
Right. Yes. So OPM also has a plan comparison tool on the OPM website. And with this tool, you'll simply enter your zip code, whether you're interested in dental or vision, and whether you want to see monthly or biweekly information. And then it'll bring up a list of all of the plans that are available in your zip code region. And you can review a brief summary. Again, as we see in this little yellow box here, we always encourage you to go to the plan brochure, which is the official statement of benefits. This is just summary information that's presented on the website. You can find almost all the answers in this official statement of benefits. Okay, and then the official statement of benefits, as I was saying, just like FEHB, the black and white federal FEDVIP plan brochure is the official statement of benefits. And it contains most of the answers that you're going to have questions to, about reimbursable benefits, rating regions, premiums, what the various CDT or payment codes are, and what excluded procedures exist. If they're not covered, they're listed in the exclusion sections at the end of the covered areas. So we recommend reading this to get all of the information, more than just the summary that you'll find on the plan comparison tool. So what can you find in the brochure or the statement of benefits? And the places that I think people should look are section 4. That's the cost for covered services. That gives them details on copays, benefits like the annual maximum and the lifetime maximum benefits for things like orthodontia. It defines what plan allowance is, and it also gives you the difference of your co-insurance for in-network and out-of-network. And of course, out-of-network, as we've mentioned, will also include any amount that your provider bills on top of whatever the plan allowance or the customary payment is. Section 5, of course, is going to tell you everything that is covered. It is the list of dental payment codes, so you can read that, or you can give it to your provider to read, and they'll know exactly what is covered. And this is listed by Class A, which is the preventive care, B, which is minor restorative, C, which is major restorative, and D, which is orthodontics. Section 7 is a good one to look at too. It lists things that your plan doesn't cover. It's the exclusion section. We also have a section that talks about how you dispute a claim. If you've had a claim denied and you don't think that that's right, it tells you the process you need to follow to see if you can get that paid. It also talks about non-FEDVIP features. Non-FEDVIP benefits are special value adds that carriers include with their plans, such as some offer smoking cessation programs or weight loss programs. Some will give you discounts on hearing aids, things that aren't necessarily dental or vision, but they are health and wellness related. Of course, the summary of benefits is a good place to look. It will give you a lot of the same information that you'll find in the plan comparison tool. And of course, you will find at the end of every brochure the rate information. Okay, so now before making your final decision, you should always refer to this. Yeah, that's about it. So where do you find this?
Where you find them.
Yeah.
I was going to ask you that.
Thank you. So for OPM, and I know this is different for benefits, but I'll tell you where OPM, you can find it on the website when you go to the dental vision section. The overview pages have links to the OPM brochure. Now this year is going to be a little new. We've updated it to be 508 compliant. So you'll have a link to an actual website brochure that is 508 compliant, and you just scroll the entire page for everything you need. And then there's also a link to a 508 compliant PDF that you can print out, or you can just read online.
And
so
actually,
benefits.
I do want to just add a little bit of feedback that I hear during health fairs. Again, when they used to happen, every health fair season, I would always run into a handful of people who are actively shopping for a new dental plan. And the reason always was that they went through a procedure that either wasn't covered or wasn't covered to the extent they thought it would be covered. So they got burned, basically. They're looking for a different plan. So this is just my my pitch to have people, if they're, especially if they're going to have costly dental services in the next plan year, to truly read these plan brochures to see what would be covered and to what extent there'd be any cost sharing. Because you can't always go by that premium on the Comparison Tools website. You got to see truly what's going to be covered.
That's good advice.
Yep, absolutely. So why don't you switch the slide, Connie, and Vicki, I'm going to ask you, because these are the sort of questions your area gets a lot. And frankly, agency benefit officers, these are questions you might get from your employees, like where do I go for this or that instance? So if you want to run through these, Vicki, that'd be super helpful.
Absolutely. And there are some very common questions or phone calls that we get that come into benefits that should go to the carriers. So being aware of who handles what is a really great tool to help and avoid additional phone calls. You know, if you call us, I mean, we'll transfer you over to the carrier, but just to avoid, you know, lengthy phone calls and delays. So when you think about benefits, and Beth touched base on benefits a little bit, as far as eligibility and enrollment, you would contact benefits to enroll, to make any changes to an existing enrolling, if you have any questions on qualifying life events. Benefits also handles the billing, and basically what that means is Beth was talking about pre-tax and post-tax deductions. So we'll handle gathering those. So if it's a pre-tax deduction, we'll be sending the payment request, for lack of other words, payment request over to the agency in order to gather that premium. And if it's post-tax, it could be coming out of somebody's retirement or annuity, or we could be direct billing them. So we would handle all of the billing of the premium. The difference is if there is a claim, that is something that the carrier would handle because they're the actual insurance company. So we often get a lot of phone calls about, you know, questions on claims. Customers think that we're able to see claims and we're not. So just that's a big difference between the two. If a customer is looking to make an address change, they would contact benefits. And once we take any action, like a qualifying life event or, you know, there was an address change, anything like that, once it's updated in our system, we automatically send it over to the carriers. And it generally takes about 3 to 5 business days to update with a carrier. But the benefit is there's only one phone call to make. The customer only needs to contact benefits about both dental and vision, and they don't need to contact the carrier as well, like when they're just making an update, like an address change. Then if we move over to the carriers, like I said, they're the actual insurance company. And I think sometimes it's helpful to think about things like that. So they would pay the claims. They would provide ID cards if they do. Some of them have gone green and don't provide ID cards, but even those you can go onto the carrier website and print up your cards if you'd like. They handle the predeterminations, the payer process, anything you can think related to the actual insurance company is what the FEDVIP carriers would handle. Hopefully that was helpful.
Oh, it's good. It's a good, and this is a good cheat sheet too, because again, we run into employees all the time during health fair season, and they ask a question, and I direct them right to their carrier for XYZ question, because we kind of do the administrative function as the portal, not the coverage, basically. So, Connie, if you want to move forward, we're going to go through my favorite part of the presentation. I'm joking. So we're going to briefly touch through the FEDVIP terms and conditions. So we're going to switch gears a little bit. These are the sorts of things that enrollees have to agree to before enrolling in a FEDVIP plan. And this really makes sense, though, because FEDVIP is a self-certifying program, you know, so we have to ask a series of questions, and they have to attest that they understand certain things before they can enroll. And Benefits recently updated its terms and conditions. So these actually might be new to some of you if you enrolled in Benefits FEDVIP some time ago. So this is the language that new enrollees will see and attest to when enrolling. If you want to move to the next slide, Connie, and I will say that we will run through all these very quickly because the legal language is lengthy, and so it's not necessary to review the slides verbatim. But essentially, an enrollee in FEDVIP, when they're on that benefits.com site enrolling, they certify that they're eligible for FEDVIP. That dependents they're adding to their plan are also eligible, that they understand that a dual enrollment is not allowed, and that family members are enrolled under one primary enrollment, regardless of the physical location of the residence. If you want to move to the next slide, Connie. In addition, they understand that if they enrolled while not eligible, the plan can change or be canceled immediately. And if there's a dual enrollment, one of the enrollments will be canceled. Next slide. In addition, their FEDVIP plan can ask for documentation about eligibility, and that must be provided within 60 days. And if they don't provide it or the documentation is insufficient, the enrollment can be canceled. Enrollees also attest that they understand that coverage continues automatically each year unless they cancel it during open season. And if they want to cancel during open season, they must personally take action to cancel on benefits.com. And if they fail to do so, coverage will continue as is. And we also ask them to understand that the opportunity to change or cancel enrollment outside of open season, those opportunities are pretty limited. And we're adding this all into the process to set expectations. They can't jump in and out of the program. And I have a feeling that we updated some of these terms and conditions based on lessons learned by people not understanding these things, so they'll know upfront what they can and cannot do and what have you. Connie, I think you're going to take over the next round of.
Yeah, and I want to apologize. My mouse does jump around kind of quickly, and I have a little trouble keeping it back. So yeah, moving on to enrollment. The terms and conditions also highlight some things about canceling. Some misconceptions. People feel that financial hardship, well, that is a life-changing event. Well, life-changing events are not qualifying life events. They are life-changing events. Financial hardship is not a QLE and does not allow one to change or cancel coverage outside of open season. Similarly, and sometimes together, retirement per se is not a qualifying life event either. One can't just change or cancel coverage because they retire outside of open season. Basically, we encourage them to think about when they're retiring, and if they're going to retire in late January, early February, they may want to consider not allowing their enrollment to continue. One exception to this retirement rule is active duty family members. For FEDVIP Vision Plan and the service member, they're related to retiring because the military service, you're not eligible until you do retire. But that's also a newly eligible QLE. So there's a couple steps that they can take to continue coverage, inactivate when you're in. I've lost my train of thought here, sorry. So basically, the military is a little bit different, and inactivating a family's enrollment in one and having the retired service member, because the family can be enrolled in the vision, but the service member cannot because he's active duty. Once they retire, then you can switch to having it under the sponsor, the enrollment under the sponsor rather than under the family member. That is a preferred way to do it. So gonna move along here. It's the enrollees certify that it's their responsibility to contact benefits if they have changes that are relevant to their enrollment, such as a change of address, transferring to another agency or branch, or retirement system change. It's not the responsibility of the agency or the branch or retirement. No one can cancel or change or let anyone know of these demographic changes except for the enrollee. That's what the portal is set up to do. So remember this, when you have people that are retiring, remember that if they want to make some kind of change, they need to actually go to the benefits portal and change their address, or maybe a child is coming off or something. They have to be the ones to initiate that. Now, of course, the payroll does send a file to let benefits know that someone is no longer an active employee and they are retired, but basically it is the responsibility of the enrollee. This is moving on. If my premium changes because my home address changes, the new premium rate will be effective the first pay period following the date upon which I notify benefits of my new address. Sometimes this is a matter of contention with people because they don't realize this and they wait and forget to change, and they could have been paying a lot less premium. Other times they find out they're paying a lot more, and they changed it right away. But it's just how it happens. There's no temporary extension of coverage when FEDVIP coverage ends. There's not even a 30-day grace period, which some, I guess, people don't always listen. They hear what they want to hear, but we have to make sure they know when your FEDVIP eligibility ends, you're done. There's no TCC available. There's no grace period. Once your premium for that particular period you pay through runs out, there's nothing else. We've had people that think there's a 30-day grace period get very upset because they made, now that they had all this free time after leaving their position, they made arrangements to have a bunch of work done and it wasn't covered. So we don't want that to happen. And last, if it's discovered that there are multiple primary enrollments for one family, all of the enrollments may be considered under one primary enrollment. Any premium paid prior to the effective date of the resulting plan changes or cancellations will be retained by the insurance carrier. Okay. Let's see. Again, for enrollment, benefits may contact FEDVIP enrollees about the federal benefits, but enrollees may opt out of the non-administrative communications at any time. Enrollees may also be asked to provide feedback regarding benefits, FEDVIP, and program-related processes and services. So we don't sell your information. Anything you get from benefits is going to be related to something good for you federally that you can or may not want to take advantage of. Where am I? My things are not matching up here. Hold on. How far ahead? Okay, there I am. That's where I am. I think. This mouse is driving me nuts, and people, I really apologize for this. Okay, so now, if I sound a little discombobulated, it's because my notes aren't matching up with whatever's showing on the screen always. Okay, so we ask enrollees to authorize premium payment deductions, and this is at the time you enroll, and any more information that benefits may need. They need information to deduct from bank account. For example, if they're not able to deduct from your pay, you can establish an electronic funds transfer, which we refer to as an automatic bank withdrawal. And then the employee understands that plans and premiums are reviewed on an annual basis. They authorize future premium adjustments to their plan when enrollment continues for the following year to be deducted from their pay. annuity, retirement pay, or bank account is applicable. We hear a lot from people that think we're just deciding we're going to take money out of their account. This is part of the terms and conditions they agree to. And so it's a good thing to remind them of that. And I think that's pretty much everything about, did I cover it all?
I think Vicky's going to cover a little bit of premium payments. That's the one right there. Yep.
Right there.
Okay.
Thank you, Connie and Beth. So as far as premium payments in the terms and conditions go, as Connie was stating, when you agree to the terms and conditions, or when the customer agrees to the terms and conditions, and let's say their payroll deducted, what they're authorizing is for us to deduct from their payroll, but they're also authorizing if for some reason, and I briefly touched on it earlier, if for some reason premiums aren't available, let's say they go on a leave without pay status, we're going to send direct bills. And those direct bills must be paid by the due date to ensure that the coverage remains active. From what I hear from customers a lot, there are other benefits out there that they may, the term I hear a lot is suspend premium payments while on, leave without pay. That is not the case with FEDVIP. So we will direct bill if we're not able to get the premiums from the payroll, from the retirement. And sometimes people do get switched from automatic bank withdrawal to direct bill if there's any problems pulling the premiums from the bank. And that can be anything from insufficient funds or anything like that. So it's just important that they understand that they're making that authorization to us to pull those premiums. Now, at any point that the account has a past due on it, let's say they're on leave without pay, we're direct billing them, and even though they're paying the direct bills, we don't generate a direct bill until there's a past due on the account. So when they return to pay status, there still may be a portion due as far as the past due on their account. So when we proceed to go back to premium deductions from pay, we may have to recoup that difference. And what that could mean is a single deduction from their first paycheck back, and then possibly a double deduction or more in future payments to bring the account current. So it's just understanding that this is the process that we will handle, going from one to the other and depending on what the circumstance may be. And I think I have the next slide too.
Yeah.
Okay, thank you. The other portion is that the customer is authorizing that we receive information about their federal employee health benefits. And basically what this means is when we go through our pre-note process, we're verifying confirmation that somebody's enrolled, like a federal civilian employee. And on our payment file, when the premium is returned to us, we often receive information as far as what the customer is enrolled in for their federal employee health benefits. We store this and we send it over to the carriers for coordination of benefits. And this just helps with the first payer process. We touch base on it a little bit. What that would mean is if somebody has FEHB and they have a claim, the claim would always go through or be processed through their FEHB first before it goes through the FEDVIP carrier. And I believe I have the next one too. Yeah, so I think it was Connie or Beth that talked about it a little bit, that as you go through the terms and conditions, or the customer does, there's some, legal language that we have to put out there. And what we're trying to express is as far as the fraud acknowledgement is, going back to the beginning of this presentation, the program is self-certifying. So if a customer comes in and they tell us that they're eligible and they give us all the information that we put in our system, or they go on to Benefits, the benefits portal to enroll on their own, they're saying that they're eligible, and they're acknowledging this. And Connie was touching base a little bit too, that, we can request documentation if need be, but we don't look at this. We don't do research to ensure that somebody is eligible. Again, the customer's saying that they're eligible for the program. When we put this out there, just so that they understand that, if for some reason, there's any information that's misleading or prompts us to, look into the account further, they may receive some information as far as looking for documentation about their eligibility.
Okay, I think that was pretty much it, right, Vicki?
I think so, yeah.
Okay. So enrollment confirmation. After one accepts the terms and conditions as part of the FEDVIP enrollment, the enrollee will receive a confirmation showing the enrollment details that they put into the benefits portal, which include the name of their carrier, the plan type, the plan option, higher standard, and the enrollment type, whether that's self, self plus one, self and family, and also includes the premiums and frequency amounts. We highly suggest that the enrollee reconfirms all of this information as soon as they get this email, because they don't have, in open season, they have a lot of time to change it, but as a QLE, they do not. People can change their enrollment as many times as they want during open season, because the coverage doesn't take effect, until January 1st, and open season ends the middle of December. But it's extremely important to note, this is not the case outside of open season. While they do have 60 days to enroll, it is not to be considered the same type of opportunity as an open season. Once they enroll, they've set their enrollment. When you're a new hire, you have 60 days, but as soon as you put that application, registration, whatever you want to call it, in, it's going to take effect the first day of the pay period following the one in which you place that registration. So it's only a few days sometimes before that becomes active. So they must look at this confirmation right away, and if it's not what they expected, it's not what they thought they had selected, they need to let benefits know as quickly as possible.
Yeah, and actually, Connie, we did get a question about effective data coverage. So you actually just answered that question. For new hires, its effective date is the first day of the pay period following the enrollment, and then for open season enrollments, it's January 1st the following year. So if you guys want to confirm that, so there might be a couple different effective dates. And then a little bit later in the presentation, I'm going to mention for military retirees, there's a couple different things there, but we'll talk about it at that time.
Okay. All right, so moving right along, it's important to review the enrollment confirmation for accuracy, contact benefits immediately. If there was an error, otherwise the enrollment is locked in and it will not be able to be changed until open season. So make sure you let the new hires and newly eligible people that are enrolling know this, so that they don't get into this type of situation. Let's see here. And then I think Vicki's gonna be talking to us again about some of these things that you can do during open season, that your employees can do during open season. Some need to be called in, others can be done online.
Yes, thank you, Connie. So I guess if I can stress anything at all, is there's just so much that a customer can do on benefits.com, from a simple address change, check their eligibility, they can do enrollments. So when we're talking about outside of open season, so we're talking the plan year, they can go on to benefits.com, they can do a new hire enrollment. If they're a new survivor annuitant, they can do an enrollment. They can change their ID with benefits and their password, unlock their account, make qualifying life event changes as long as they're within the timeframes. And I think Beth is going to touch base on that a little bit later. And as we spoke about, they can research plans and rates, both on benefits.com as well as opm.gov. The things that we would want to encourage them to call us for is if they've had a status change or they're enrolled as civilian federal employee, but they're also eligible as a military retiree. That is something they would have to call benefits for, call customer service for, and we would make that update. If there was a change that was needed to their social security number, that is something that we would have to do for them. So they would want to contact us directly. If they need to make changes to, a status of a family member, for the most part, they would want to contact us directly. And as far as canceling coverage due to a qualifying life event, that is something that they would contact benefits for as well. And in addition to that, the belated action requests.
Advocate, do you mind just going a little bit more into the belated actions? That's something I'm not as familiar with.
Absolutely.
Yeah.
So once open season ends, we do have what we call a belated action period. And that is when somebody has had a situation like not having internet access or phone access to take action during open season. If that is the case and they meet the criteria, and it is outlined on our belated action request form that they would have to fill out and send in to us, but they would tell us why they weren't able to take action during open season, and then they can request that belated action. A key point there, Beth, to add to that conversation is if somebody fills out a belated action request form and it's approved and they're taking action in February, that change is going to go back to January 1st of that year as if that action took place during open season.
Thank you.
Does that help?
It's great. Yeah. And one question, I know you mentioned the belated action period when open season ends. Does this exist at all for new hires throughout the year, or is belated actions only an open season possibility?
There is a belated action period throughout the year too,
okay.
And it works very similar, where they would have to meet the criteria, fill out the form, send it into benefits for us to process it, and we notify regardless of the outcome. So for whatever reason, if the belated action request was denied, they would be as aware of that via letter as they are if it was approved. So we do notify to both.
Thank you. Hey, Connie, you're going to kill me, but do you mind going back a couple of slides? I think we missed the actions folks can do during open season. Yeah, on benefits and to call. Yeah, because this is the season we're entering up right now. So I think you can go on about these actions too.
Absolutely. There isn't a lot of difference between outside and during open season for actions that you can take on benefits.com, but I'll go through the list. Again, you can check eligibility. You can research the plans and rates, take care of any open season enrollment, new hire or survivor annuity enrollment, open season change to the enrollment. So in other words, let's say at the beginning of open season you enrolled and then you decide you want to change what you took for an open season action and we're still within open season, you can go back into your account and you can change that, or the customer can. Open season cancellations are open on benefits.com. So that is one of the major differences where a qualifying life event cannot be done on benefits.com regardless of open season or plan year. If you're taking or the customer is taking an action to cancel due to open season, that option will be available on benefits.com, and it really is as easy as clicking a button. Again, they can do address changes, update their password, unlock the account. The reasons to call benefits during open season, again, they're changing federal status. Social Security number is incorrect in the enrollment and it needs to be updated. They're looking to update their federal employee health benefits, meaning they've changed from one to the other. They would call us to make that change. And plan year cancellations due to QLEs, they would have to call us directly.
Yeah. Well, actually, speaking of QLEs, do you want to pop us forward to the QLE? Thank you. Awesome, thanks. Okay, so we just touched upon QLEs and how they can perform online outside of open season, but you got to call during open season. But QLEs allow one to enroll, make a plan change, or cancel coverage outside of open season, and the actions you can perform really depend upon the type of QLE that you've experienced. The time frame is generally from 31 days before to 60 days after the event. And it's important to note, FEDVIP QLEs are not the same QLEs for the FEHB program, FEGLI, FSA Feds, or even TRICARE. Each program has its own sets of rules and regulations. So we'll review the QLEs for FEDVIP in detail. So we'll start off with marriage. Obviously, this is a QLE, and you can enroll for the first time, increase enrollment type, for example, from self to self plus one, or change to another FEDVIP plan. And for this QLE, you can submit this anytime from 31 days before to 60 days after the date of the event. The next QLE is acquiring a family member. And with this QLE, the only action you can perform is to increase enrollment type, for example, from self plus one to self and family. And there's no other actions you can perform when acquiring a family member. And for this, it's the same time frame. It's 31 days before to 60 days after the date of the event. Losing a family member. Similarly, if someone loses a family member, the only action they can take is to decrease enrollment type. And this is the same, no, this is a different time frame. This can occur anytime starting 31 days before the date of the event, and there is no time limit for this one.
And then I believe this one's
you.
Sorry, I didn't mean to jump ahead of you, Beth. So loss of other dental or vision insurance. The key point is other. So somebody has a loss of insurance, they can call us, as Beth was stating, or go online 31 days prior to the loss and up to 60 days after. And they can enroll the entire family if they want. So the entire family doesn't need to have had the loss. Just one eligible family member needs to have the loss to do a loss of enrollment, loss of insurance enrollment. So the other one is moving out of the regional plan areas. So Connie touched base on this earlier of our regional plans. So if somebody has a residential address change and that address change moves them outside of that region, this allows that customer to go ahead and change their carriers from one to the other. And there's no time frame to do this. So they can actually even change their address today and contact us back a month from now to update the carrier. What that means, though, is whenever the carrier is actually updated, whenever the change is made in the system, that's always prospective. It goes to the first day of the next pay period. So if they do delay to do that, it's just important for them to keep in mind once they change that carrier, it is prospective. As far as enrolling a spouse, yes, sorry. Enroll your spouse deploys to active duty. So what this means is if they choose to, if they're enrolled as a federal civilian employee and themselves or their spouse is deployed to active duty, they can contact us to cancel. They can also keep their enrollment, and if so, we'll direct bill them, kind of like what we spoke about earlier. If we're not able to get premiums while they're deployed through their payroll, we will direct bill them. But it is an option to cancel, and it must be done 31 days prior up to 60 days after the deployment, and outside of that time frame, it would have to be an open season cancellation. On the other end of things, they can also enroll if the primary or the enrollee or the spouse returns from active duty. So again, 31 days prior up to 60 days after, and it's a brand new enrollment moving forward, meaning the first day of the next pay period.
Okay, so moving on to return to pay status from leave without pay. When an employee returns to pay status after leave without pay, they can enroll as if it were the first time or if they were canceled during open season. So if they went into leave without pay and did not continue paying their premiums, then they can enroll. And in that sense, yes, they can change to another plan. The employee may change to another plan if their enrollment was canceled. So it's more like a new enrollment opportunity when you return from leave without pay, because you're going from unenrolled to enrolled, not like from plan A, just going from plan A to plan B. When it comes to the timing to perform the QLE, if you're enrolling, you can submit the QLE anytime from to the date of the event up to 60 days after. And if you're changing your plan, you can submit the QLE anytime from 31 days before the date of the event and up to 60 days after. And then this information is provided in the plan brochure and statement of benefits. They can read more about that there. If the annuity and compensation is restored, when an employee's annuity or compensation is restored, they can enroll for the first time or they can re-enroll. This QLE also can be extended to uniformed service members and families if retirement pay or uniformed service pay is restored. They may also increase or decrease their enrollment type. And the timing on this is they can submit this QLE anytime from the date of the event up to 60 days after. Let's see, what are we? Okay, transferring to certain agencies and you're still eligible. This is, again, well, it's specified in each of the plan brochures or statements of benefits. Generally, you can only cancel enrollment during open season. However, this is one of the, I think there's maybe 2 exceptions. If an employee can cancel only if they are transferring to an eligible position at a federal agency that provides dental or vision coverage with and pays 50% or more of the premium. So if the agency has their own that they offer, then an employee can cancel the FEDVIP to take advantage of their new agency's plan. Gosh, things driving me nuts. Sorry about that. The QLE timing for that is you submit the QLE anytime from 31 days before to 60 days after the date of the event. And that is if you're transferring agencies. Also, when an employee retires, we've already gone over this. We all know retirement is not a QLE. So how will benefits know who to bill? What does the employee need to do? And what does the agency need to do? Vicki, do you want to walk us through a little bit of this?
Absolutely. So when a civilian federal employee retires, we've been reaching out to their payroll for their premiums. Once they retire, the agency will send us indication. They send us a retirement code so that we know that the person's retired, and then we start the transition into retirement. And basically what that means is we move them out of the pre-tax premium deduction from their payroll, and we switch them over to an annuitant, which is a post-tax monthly deduction. There is generally a period of time when the annuity is being finalized that during this time we're not able to pull premium deductions. So during that time we would send the customer direct bills, and once their annuity is finalized and we're able to take deductions directly from their annuity, then those direct bills will stop and we'll start pulling directly from the annuity itself. And kind of like what we spoke about before with like the leave without pay option, if there is a past due on the account when somebody's annuity is somebody's annuity is finalized, we'll go for that single deduction from their annuity, and then we'll double deduct after that if need be, to bring the account current. The customer does not need to contact us directly. This is generally a very smooth process. However, it is a good reminder that often when there's a life change, like, going from a federal employee to a retiree annuitant, there's often an address change, a phone number change, an email change. So it's real important that they do contact us to update that information. So any type of letters or communication that we send out, that they'll receive.
Vicki, I just have a follow-up question. We talked to benefit officers, and for some reason they still think that the enrollee has to contact benefits. I don't know why that is. So is there any benefit to having someone contact benefits to let them know they're retiring, or is the process truly dependent on when we receive the notification from the agency on the retirement?
Yeah, well, we do need to receive the notification from the agency. However, just as life happens, sometimes there might be a little bit of a delay from the retirement to us being notified. So what I would say is if the customer, if they've retired and we're no longer getting deductions from their pay, and they haven't received any documentation from us other than possibly direct bills, but they haven't received notification that we've switched them over to their annuity, they may want to just touch base with us in that case, but generally speaking, it's a very smooth transition and they don't need to contact us at all. We'll take care of it on our end.
I'm actually going to talk a little bit about retiring service members. Again, if you don't work with the military, this does not apply to you. This is not for civilian or postal agencies. But again, we might have some folks who work on bases along with active military and those who are about to retire. So you might be exposed to this. So I'm going to review this pretty quickly. Retiring service members are considered newly eligible for FEDVIP. Now, again, retirement itself is not a QLE. They're just considered newly eligible, like a new hire is considered newly eligible. It's just something that is, basically. These folks can enroll in FEDVIP Dental, and if enrolled in a TRICARE health plan, they can also enroll in a FEDVIP Vision plan. And they have to take actions. Enrollment is not automatic for retiring service members. And they actually have a 91-day enrollment period and can enroll in FEDVIP between 31 days prior to their military retirement and up to 60 days following. The timing as to when they enroll will affect their coverage effective date and may also affect whether there's going to be a gap in coverage between their active duty dental, for example, and the retirement dental. So I'll run through these real quick. So if these folks pre-enroll, their FEDVIP coverage is going to be effective on the retirement date, and there's no gap in coverage. So we're trying to get the word out that the retiring service members can pre-enroll, and then the coverage is seamless from the active duty to the retirement dental, for example. If they don't pre-enroll, but they enroll up to 60 days after the retirement date, coverage will be effective the first of the month following the enrollment date. So in this instance, there will be a gap in coverage between their active duty coverage and their retirement coverage. And if they miss this 91-day enrollment period, then they have to wait for the next open season, which would be a very large gap in coverage. So there's a couple of different scenarios there. But again, only applies to retiring service members, not civilian or postal service employees. So we want to go to the next slide. Oh, you did. Thank you. We just reviewed what happens when someone retires. Again, it's different for federal civilians and for uniformed services. And Vicki, what happens when an employee transfers to another agency? Like, what do they have to do?
So an employee transfers to another agency, they would want to give us a call and provide us the information as far as, you know, what their new agency is, and then we can transition them over. There are sometimes we get that information from, I will say, the outgoing agency, but not always. So it is always safe to let us know. And that is something they can let us know in advance. And our customer service agents will put in the request to transfer them over once they've actually made that transfer. So again, it's real important in this situation to let us know.
Okay.
Yeah, and you are benefits essentially, Vicki. So can we set some expectations here? Can agency benefit officers talk to benefits? Can spouses? Who can talk to benefits on the actual enrollments?
So in order to speak with anybody other than the primary, we would need either verbal or written authorization. So verbal is an easy one as long as the primary's there, or we can get a hold of them. If we do get verbal authorization, just please be aware that's for one phone call, and that isn't ongoing. The other ways that we can get authorization to speak with somebody else is there are two forms. We have what we call an authorization for disclosure of information form. And basically what this means is the primary would fill it out, send it into benefits, and whoever they authorize for us to speak to, we would have that on file like a spouse, and anytime that spouse called, we'd be able to talk to them. The difference, or something to remember there, is that only gives us authorization to speak with them. It doesn't give authorization for them to make changes. In order to make any changes on an account, we would either need verbal authorization or we'd have to have a power of attorney on file. And it really goes for anybody that contacts us. The only difference is if the primary is a child under the age of 18. In that case, we would speak with the parent or guardian.
And we are going to get to it a little bit later in the presentation, but for agency benefit officers, the one time they can speak on an employee's behalf, if they're submitting an incapable of self-support request for a child, and we'll get to that a little bit later in the presentation. But if you want to move to the next slide, we do have resources for benefit officers at benefits.com/ABO. There's a dedicated page for you all. Also, when you're on benefits, this link is at the bottom of any page you're on. And it basically says for agency benefit officers. And on this site, there's FAQs, training support, including webinars we'll be adding this fall for open season, materials you can download, and this is both for federal, civilian, and military audiences. And I can say the materials actually were all updated as of yesterday, so they are current for open season. If you want to go to the next slide, thank you, Bonnie. Here's the material place. When you click on it, there's a generic, and first, I just want to say, please use these pieces. You can download them, but you can also contact us and we can send them out free of charge. So if you're doing any new enrollee orientations, there's some great pieces. The first one is called basically the benefits info card. This is generic. It can be used with all eligible groups. And we even have a version for new hires that's the exact same content. It just has a little sticker on it that says new enrollees have newly eligible have 60 days to enroll in FEDVIP. So again, consider that for your new employee orientation. We have dedicated flyers for military training, and we work with a lot of transition officers on bases, retirement service officers. We utilize those materials on that side of the house. I can also put you in touch with your agency's dedicated account manager, and you can work with them, again, to order materials free of charge. We can do train-the-trainer sessions, just like today's presentation for your HR team. We can help you do employee training or even give you slides and scripts to do your own training. So please utilize your dedicated account manager. However you educate employees on benefits, we can give you the resources to do so. And when I'm done talking, I'll actually publish my email address, and you can use that to contact me if you want we can put in touch with your account manager. The next slide, I mentioned incapable of self-support. I will say for any webinar we do, this is the topic we get the most questions on. So I'm going to pass it off to Connie and Vicki, because you're the experts on this. Connie can give the background perspective from OPM on the process, and Vicki's area actually handles these, and she can walk you through what folks actually have to do.
Yeah, sure. Well, as you know, we had the Affordable Care Act passed, gosh, back in almost 10 years ago. And at that point in time, people were, before that happened, FEHB and FEDVIP had dependent eligibility both up to age 22. But after the Affordable Care Act, unfortunately, the dental and vision were not part of that. So they still lose dependency at age, 22. And however, the health benefits, you continue to have eligible dependents until they are age 26, even if they're married. So now, if you want to cover a child that is incapable of self-support, meaning that they, they can't take care of themselves, they can't earn their own way, they're going to have to be covered by you for the rest of their lives, then you have to certify them as incapable of self-support still at age 22, even though they don't need the medical care yet. So we've had to figure out how to get that done. And over the years, we've gotten a little better with this process, but I'm gonna, why don't I let Vicki say a little bit about her part first, and then I'll go on to the next page. Or does that seem right? I mean,
Sure. Yeah.
Do you have? Yeah.
Absolutely.
Basically, we have a process, and it has to do with what is considered an incapable of self-support person, how that gets verified, and then what you need to do to notify benefits of this. And I think, Vicki, you can help out with that a little bit.
Sure, thank you. So I'm a fan of tying things in. So going back to ensuring that we have updated information like, a mailing address, residential address, things like that. Prior to a dependent reaching the age of 22, and actually 60 days prior to their birthday, benefits will send out a letter to the primary on the account to notify them, basically as a flag, as a reminder that their dependent's about to age off of the plan because they're going to be 22, they're no longer eligible. And it gives them guidance to remember that if the child in question is incapable of self-support, we would need to receive documentation that they are. So the approval comes from the agency as far as the dependent being incapable of self-support. And if that information is received prior to their birthday, what we do is we just update their status to a dependent over the age of 22 and incapable of self-support. And then that way they would have seamless coverage, meaning they wouldn't drop off at their 22nd birthday. And then I think the next slide talks about, that 60-day period.
Is that, let me see. Well, this kind of goes through.
Maybe that one is too. Maybe it's me just going off. I'm moving around too much with my glasses. So if a dependent has been removed from the plan because they've reached the age of 22, but they are incapable of self-support, there's a 60-day window for us to receive that authorization of incapable of self-support. If we receive that information within that 60-day period, what we'll do is we'll add the dependent back on the plan with seamless coverage. So it's a matter of getting that to us timely. And, you know, once it's here, if it's here on time, whether it's prior to the age of 22 or within that 60-day period, we'll go ahead and take action to add the dependent back on to the plan if they were removed. And that's all taken care of moving forward. Now, for some reason, if let's say the customer forgets, whatever the reason may be, and now they're outside of that 60-day window. So the dependent's been removed, they've been removed for 60 or more days from the plan. If they're looking to add their dependent back on to the account, they would, one, still have to get us the approval of incapable of self-support, but they'd have to wait until the open season to make that addition. And that addition would go prospective, meaning would be January 1st of the following year. Something that people aren't aware of that I'd like to add is even if it's 60 days after, we can still receive the approval of incapable of self-support. And if we get it, even if the customer has to wait to open season to add the dependent back on, we'll hold on to that approval so they don't have to start the process all over again or wait until they receive that letter. So let's say it happens now, we'll keep it on file, and they'll just have to take action during open season to add the dependent.
Yeah, and I would say too, if you happen to be talking to somebody about their benefits and they happen to mention that they have a child that's incapable of self-support, no matter what the age, if it's less than 22, I would go ahead and start working on it just to make sure they're covered.
Agreed.
And Vicki, so age 22 is for federal civilian. Civilians and U.S. Postal Service employees, and it's going to be age 21 for military families, right?
That is correct. So 21 to 23 for military families if they're a full-time student. But at 21, that is when we would drop the child if we don't have approval of incapable of self-support. You are correct.
Thank you.
You're welcome.
So BAL 13208, which hopefully will be updated at some point soon, was created and distributed kind of to get this process across. The verification or the certification is done by the agency, the employing agency. It should be made, as Vicki's been saying, within 60 days after the initial 22nd birthday. And the guidelines for making the determination are the same as those that have been used for FEHB and are continue to be used for FEHB. It's only a matter of the ages and whatnot that make it different. There's a list of these medical conditions on attachment 1 to this BAL. This BAL also discusses what is needed once you get the determination. Not the actual documentation. Benefeds does not store documentation. They are not a record keeper. They just have to have the information and have had it verified. So it needs to be emailed immediately to Benefeds at FEDVIP administration at ltcpartners.com. Did I miss that somehow? No.
That's administration, and actually I'm going to push that out in an announcement as well.
Okay, yeah, I was going to say, did I forget to change the slide? Because I didn't remember that we didn't add that on there. Okay. And,
yeah, it's on the slide, but yeah, it's okay.
Yeah. Okay, so notifying. Benefeds only needs an email from you. What this email has to have is It has to be from a federal email address with the signature of the HR office preferred and the HR office professional. It should specify the enrollee's name. It should specify the dependent's name, and it should specify the status of their disability. In most cases, the status is permanent. However, there are in some exceptions where there will be a temporary status. The disability is expected to be resolved at some point, so they have some type of a date attached. If you have a date, then that should be included as well. But the most important part I want to say is do not send any attachments. This is called PII, PHI, and we want to avoid transferring any of that, you know, just to keep that safe. So this is a sample email of what it would look like. So we've got the address right here, FEDVIP administration at ltcpartners.com. The subject, I just put IOSS certification, that's fine. Please continue eligibility for the following: effective 22 birth date, open season effective, blah, blah, blah. The enrollee, Papa Bear. The dependent, Baby Bear. The status, permanent. Now in red, of course, I say, if they're expected to recover, you will have a date in that section. And then there's your signature. It's the benefits officer at U.S. federal agency. So this is what they need to see to get that taken care of. I think y'all are getting pretty good at this over the years. So I'm going to move along to some of the things that are in the pipeline. I feel like I'm always saying this, but I've checked with policy and it appears that things are still not final. So basically, some of the things we're looking at are, we have, as you know, we've added the uniform services. Certain uniform services are eligible for FEDVIP, and we have noticed that some of the uniform service members have been granted disability and disability benefits by the Department of Veterans Affairs. And they no longer really require FEDVIP coverage because they're getting free dental coverage. This is one of the things we're working on, getting QLEs approved for it so that they may cancel a FEDVIP enrollment if they become eligible for these benefits. They may decrease an enrollment of a dependent if a dependent becomes eligible for these benefits, and they may decrease an enrollment if a spouse is of the enrollee is actively employed to military duty. That's another one that's in the pipeline here. It already exists for, I guess, federal employees, but only applies to civilian status, not to the uniformed services right now. The need for these QLEs has been identified because of the added population. We transitioned about 1.3 million enrollees when we took over the TRICARE retiree dental program. And that's when we started noticing this need. So other things, to expand another QLE, expanding the FEDVIP eligibility to certain employees that previously became eligible for FEHB benefits. This one is the one I've been saying for a couple of years now, and it still is not in final form for QLE. The regulations have not become final yet. So basically, you've heard this before. There was a group or several groups that became eligible for FEHB because of the way the regs were written. It didn't cover FEDVIP, so we're working on getting that covered. There's temporary appointments and seasonal schedules, intermittent employees, firefighters, and intermittent emergency response personnel. Let's see. And currently, if an employee is in one of these groups, they are expected to work, or if they work 130 hours per calendar year per month for 90 days or more, then they are eligible to enroll in FEDVIP upon notification by their employing office. So part-time employees are not eligible at all, but these temporary seasonal employees do have some eligibility. And then I guess
I just want to jump in because when I started to learn more about benefits a few years ago when the TRICARE retiree dental program transitioned, and I know they enhanced the enrollment tool, and it's actually pretty easy to use. I was on there the other night, and this is a self-certifying program, and so they've really buttoned up when someone's online determining whether they're eligible for dental or vision or both. We'll ask them, are you full-time, part-time, permanent, seasonal, intermittent, temporary, per diem? Like, we bring them through like a decision tree of questions and answers. It's pretty slick, and at the end, we kind of work it out for them based on their answers if they're eligible or not. It's a nice enhancement they've done over the last couple of years.
Yeah, and I have to say we haven't been getting quite as many inquiries with regard to this since the enhancements on the benefits portal.
Yeah, I know. They did your group, Vicki, did a great job with the website a couple of years ago. So cheers.
Thank you. It helps us a lot as well.
Yeah, absolutely. You're right. Anything to cut down the phone calls. Anyway.
Yeah.
So I think we're winding down here, and I just wanted to showcase some more of the resources to help you help your employees learn more about FEDVIP. Remember Benefit's excellent plan comparison tool we reviewed. If you haven't been on in a while, we've made some enhancements a couple of years ago, so it's extremely user-friendly. And of course, Connie's OPM comparison tool as well. Benefits itself is the enrollment portal, and what's great is you can check eligibility, compare plans, and enroll on the same sit-down period. So it's extremely easy to use. There's detailed education and support for benefit officers, both for federal, civilian, and military families. So I showed you the dedicated page for ABOs. Employees can always call benefits, and there's the number. But again, we're trying to stress the many self-service functions they can do themselves, both during and outside of open season. And those two slides that Vicki reviewed, what they can do on benefits or call both during and outside open season, that's a great cheat sheet if you get questions on how to direct your employees as to what they can do themselves. Connie reviewed the plan brochure, and again, that's the best and final place where employees can assess what benefits and what potential cost sharing they may be in the next plan year. And I'm going to quickly demonstrate, not unfortunately interactively, but as a slide, a resource we'll have this fall. It's called the Virtual Benefits Fair. We lovingly call it VBF for short. So a couple of things. I don't know if your agency has utilized this. We've been doing it for about 7 years. And we invite in a single location programs such as the FEHB carriers, FSA Feds, of course, all the FEDVIP carriers, and we have representatives from benefits who can answer questions. I can say this year we want to get more eyeballs on it, so we actually are hosting it, and employees can access it on the benefits.com website. So that's the place to go now. So not ltcfeds.com/webinar, scratch that. It's not there this year. We're going to put it for a wider audience on the benefits.com website. Registration is open now. So your employees can actually register, and then when open season opens up, employees can log in, they can browse exhibits, view and download plan brochures and marketing materials. They can connect with program representatives via online chat and get their personal questions answered. And we're also having a dedicated booth for uniform services. Because again, they're only eligible for FEDVIP, but not eligible for some of the other federal programs. Last year, amid COVID specifically, more than 43,000 people visited the fair, and we hope more people will take advantage in the fall. For those of you who service your agency's retirees, also a great resource for them. Hopefully one day we'll go back to on-site health fairs, but retirees don't often have that benefit. And so the online fair is great for them too. As I said, it's actually live. People can register on benefits.com. We have emailed out to our contact database, the registration and promotion you can use with your employees. If you did not get that email, you can email me, and my name is Beth O'Brien. So it's BOBRIEN at ltcpartners.com. I also published it in the Q&A if you want to grab it there. I can make sure you get the communications on the virtual benefits fair that you can then send to your employees. And I will give some perspective. So in the field last year amid COVID, we had many agencies struggling to host their own online virtual fair. It's a lot to have to do from the ground up. I would take advantage of what we've been doing for 7 years. We've been doing it. We have all the carriers. And, you know, some of the agencies decided not to put on any health fair. They just referred folks to the virtual benefits fairs. If you need any demos, if you need us to talk to your policy people, your HR folks to help them make a decision, contact us and we can have those meetings with you. And then the last slide, some final resources. Benefits portal at opm.gov. That's the place to go if you need to get in touch with OPM about FEDVIP. We've already mentioned benefits.com/ABO and all the resources there. I have given you all my email address to get in contact with your dedicated account manager. If you missed it, we have an agency lookup tool on the LTC Fed's ABO page. So it's pretty easy. Type in Veterans Affairs and your account manager, Charlie Griffin, will come up with his contact information. So there's always a tool to locate your dedicated account manager online if you need to, but that is not on benefits. It's on the ltcfeds.com. So I think, are we ending here?
I think, and we should probably take a look at these questions that we actually haven't probably looked at as closely as we need to.
Yeah. Okay. So I've been eyeballing them. If you want me to jump in,
that would be great.
Okay. Yeah. So here's a question. Kind of makes sense. So what if a family member only needs dental and vision, but not medical? Meaning, I guess what they're saying is, and if the person says they have disability, probably disability medical. But how I'm interpreting this question is, I'm the employee. I have a child or a family member who needs dental and vision, but I don't want it. How does my family get it?
Okay, well, if you are a civilian employee, the eligible person has to be enrolled. So if you need the coverage for another family member as a civilian employee, you would have to enroll yourself and that family member. We don't have a way for civilians to just enroll a family member on their own. And for that matter, while the military does, it's generally a spouse or, you know, some, not say a young child. They would have to have an older sponsor or something. But we're pretty much talking about civilians here, which is good because I know much more about that. And the civilians, yeah, the eligible person must be enrolled.
A question on, looks like a QLE. Is an employee eligible to cancel when going on leave without pay? And I don't think, well, I don't know. Actually, you guys are the experts. Why am I bothering?
I think we covered that. Oh, what did I do with that?
We have return to pay status from leave without pay, and they can enroll or change to another plan. But are they eligible to cancel when going on leave without pay?
They are not.
No. Okay, Vicki says no.
Sorry.
No, please, yeah.
Yeah, when somebody goes on leave without pay, we will direct bill them. So they cannot contact us. It's not one of our qualifying life events to cancel outside of open season. However, should their account cancel for non-payment, that's when the return to pay status QLE comes into place afterwards. So like they can cancel if they go on active duty, but not on like a leave without pay, whether they're seasonal or something like that, if that makes sense.
Yep, that does. Thank you. Another question, when transferring to a new agency, a lot of times we do not know the new payroll ID number. How do we ensure that the correct payroll office information is submitted?
So if the customer doesn't need to provide us with their payroll ID number. Many don't have it. Many aren't even sure what that is. So what they would do is they would tell us what agency they transferred to. So let's say they were employed by the United States Postal Service and they transferred to the
I think she froze.
I think she did. Why don't we hold that question?
Yeah.
That's okay. Yeah,
Good
maybe
idea.
and I'll throw a question to you, Connie, then I'll quickly Skype her to see if she can get back on.
Okay.
Here's one actually from about incapable self-support. I'm not going to get too much into the details. I have an issue regarding the process, or rather determination of self-sufficiency. And it turns out they made a request, but the individual determined that the condition was not severe enough. And I think back, it's the agency that makes that determination, correct, not benefits.
Correct. The agency makes a determination. However, I'm not sure what, I really don't know the details on that. If they are not certain, they can request, in very rare instances, we could see if we could find our medical director or a medical director. Some agencies have a medical director person. Because it's usually you get a letter or something. Part of it is a letter from a physician. If it's outside of the list of conditions that are listed on attachment 1 of BAL 13208. You may want to. You could probably send that into FEDVIP at opm.gov and maybe we can answer it better with a little more than what you can say here.
That's the go-to address for any agency benefit officer with FEDVIP questions, so that's good. That's good.
Yeah.
I have one here that I can handle. If I have a military retiree who wants to get FEDVIP civilian to pay pre-tax, can they switch back to the military FEDVIP like when they leave the agency? So basically, can someone change their status from federal civilian to military for whatever reason to have their payroll, the premiums deducted? The answer is yes, and they can call anytime to do that. They can't do it online. They do have to call, but they can actually do that anytime, which is great. There's a lot of flexibility there. Moving on, and I will say Vicki just Skyped me back that her computer's frozen, so I don't think she'll be joining us later in the presentation. Let's see. Let me see. Is a full-time student in university over age 22 qualifies for IOSS? I think I would have them just review the whoever typed that in, review the process. So again, if it's a civilian employee, if it's civilian and their child is age 22 or older, there is a possibility to have an IOSS coverage, but they have to go through the process that you identified. And actually, I might be able to find it. It's BAL 13-208, and that's the go-to place to review that process. Let's see. Here's one that's out of the blue, and I think it's a different program. Can employees sign up for short or long-term disability? That's a different program. In fact, I don't think OPM has. They don't.
Yeah, OPM does not currently have, and there's no OPM-sponsored disability program. Your agency benefits officers, if you're asking that question, I'm guessing your agency does not have their own. Some of the agencies do. So right now, no.
Okay.
And I don't think there's any plans in the near future.
Yep. Someone asked, can you please clarify the age limit you just discussed? I think this was earlier in the presentation. It probably had to do with dependent children. So for federal civilians, it's age 22. And for military or uniformed services, it's age 21 for non-students and age 23 for full-time students. and that full-time student status has to be registered in DEERS. And then for both groups, again, the incapable of self-support options is possible after those age limits, but then they'd have to go through that process, which is in the BAL 13-208 that I mentioned. It's going to scroll a little bit more. I think we covered this one, but how do you guys take care of transfer an employee from one federal facility to the next? Basically, that's something that Vicki covered, and the enrollee has to contact benefits. So just have them contact us, and we will get that process in motion. They actually have to call us. Unfortunately, that's not something they can do online. And I know someone else asked that question today. Unfortunately, they do have to call us. And I'm kind of winding down here because we're going on almost 2 hours here. Yeah. So anyway, I think we'll probably wrap up. We're going to work with Bodo to hopefully, if we can get these slides out to you by email. We had a bunch of requests for the slides. Also, that fact sheet you're looking at on your screen there, that's available on the benefits.com/ABO website. It's all the facts and figures and timeframes and age limits that we talked during today's presentation. It's a great, like, 3 or 4 page consolidated cheat sheet for agency benefit officers. We just updated it for this open season, so please be sure to download it. And then again, I did reference my email address. If you want to get in touch with your dedicated account manager, we can help you out any issue. If you didn't see it in the Q&A, it's BOBRIEN@LTCpartners.com. And that's it for me, Connie. And Vicki's not here, but I'm sure she
I just have one here that I want to touch on.
Oh, okay, great.
It is, what if an employee went out to private carrier for coverage? Do you handle it as a QLE? Absolutely not. There is no QLE saying that if you go out and get other coverage, you can cancel. You'll still have to wait until open season to cancel that coverage.
Correct. Yep. And now, if they had outside coverage and lost it, that would be a QLE to get FEDVIP, but it doesn't work reverse, unfortunately.
Yes, exactly.
So thank you, Connie, for hosting us, and for Bodo for putting on this great, I know it was multi-webinar series this summer. So thank you all.
Yes, thank everybody for showing up. And Beth, you and Vicki did a great job. Had some great information. I hope that everybody can join us at the virtual benefits fair because it's a really nice production.
That sounds good. Thank you all.
All right. Thanks, everyone.